100.
San Antonio Methodist Hospital. The lungs of a 29-year-old badly damaged by the coronavirus need a CAT scan. A patient so critically ill, what should be easy takes enormous coordination and a small army just to get them from A to B.
We are having an explosion of COVID. We aren't overrun yet, but it's overwhelming.
Overwhelming now and expected to get worse in the days ahead. San Antonio's Bexar County has seen a sharp rise in the percent of those testing positive for the virus. In just the last 30 days, the weekly average of those testing positive has gone from 3.6% to more than 20%. So many infections, increasingly moms-to-be infected with the coronavirus. Methodist Hospital now has a dedicated unit in its NICU for babies born to mothers who have it.
That picture that every mom wants of the baby being born and holding the baby, does that happen with babies in COVID?
Unfortunately, no. We have to, as soon as the baby is born, they do bring him right to us outside of the door. So it's just a very brief moment that the mom might get a glimpse.
In the womb, the virus isn't typically transmitted from mother to child, but during the birthing process, the risk of infection goes up, and treating newborns with the coronavirus, much more complicated. Though these babies have tested negative, they are treated as suspect positive. Healthcare workers wear full PPE, and these babies born to moms with the coronavirus are kept separated from others just in case.
So you have 5 babies in here right now?
Yes.
You have room for 16?
Yes.
Do you think you're going to be full up?
I do. The way things are going, we're admitting pretty frequently, yes.
9683.
Christy Labacida, only 36 years old, is expecting her 4th child. Both she and her fiancé have the coronavirus.
Mainly the thing that really hurt was my bones were just, I couldn't lay down. It was just hurting.
Your bones?
My bones. It
like
just,
your entire skeleton,
like
your body?
Whole even to my pinky of my toes.
Pregnancy hard enough without that. She took precautions and isn't sure how she got it. Now only hoping she recovers and she, her 3 kids, and fiancé are coronavirus free by the time she gives birth in about a month.
I'm extremely stressed. I am a very strong woman. I tend to do a lot, and now that I can't and I need that help, it's taking a toll.
Methodist Hospital may be seeing the beginning of a sharp increase nationwide of moms with coronavirus giving birth.
There's actually some literature out there to support up to a 30% asymptomatic rate. So
30%?
that means 30% asymptomatic rate.
Of moms coming in?
Of moms coming in.
Pregnancy and coronavirus, only one piece of the pandemic. Methodist Hospital treating a rising tide of critically sick patients.
The last few weeks has just been overwhelming, is how I would describe it. There's been more and more patients than we really know what to do with. The patients are getting younger, and they're more sick.
How much younger?
It's gone from, probably 50s and 60s for the first wave to, I've lost track of how many people in their 20s.
This is Methodist's COVID Unit 2. It's one of 3 specialized COVID units at the hospital. Patient rooms sealed off, each one turned into negative pressure chambers, so staff only need to don PPE if they go into one of the bays.
So you have 14 rooms. How many are filled?
14,
Wow.
with a waiting list.
How long is that list?
It's long.
The hospital is creating more beds, but for now, this is where the sickest of the sick are treated.
Well, yesterday was probably one of my worst days that I've ever had.
Why?
I got 10 calls, all of whom young people who otherwise would be excellent candidates to be able to put on ECMO. They're so sick that if they don't get put on, they don't get that support, they're probably going to die. I had 3 beds. And making that decision, being able to figure out who really is going to benefit, it is a level of decision making that I don't think a lot of us are prepared for.
Those calls coming from other hospitals across South Texas with patients so sick that Methodist may be their last hope. Methodist Hospital uses a procedure to oxygenate the blood and keep patients off ventilators. It's called ECMO, or extracorporeal membrane oxygenation. Today, Dr. Della Volpe is inserting large tubes in the veins of a 33-year-old. They run from the groin all the way to the heart. The blood comes out of the body, is mechanically oxygenated, then returned back to the heart almost immediately. The Methodist team have had a lot of practice, the procedure taking only a few minutes.
It involves being able to take large cannulas. They're almost like small garden hoses, is how I would describe them. They have to be able to pump about 2 or 3 gallons of blood per minute through them. So one is draining blood out and the other one is returned.
The blood coming out of the patient is dark. It just looks unhealthy. The blood returning is bright red, loaded with oxygen. Almost immediately, oxygen level in the patient's blood goes back to near normal. Their chance of survival now better than if they were on a ventilator.
I think the ventilator really causes a lot of harm, and we're finding that it causes harm in general, but it certainly causes harm when we're talking about patients with COVID.
Because their lungs are so weak to begin with?
Because their lungs are so weak and because probably there's other reasons why patients are having trouble.
The ventilator's pushing oxygen into the lungs.
That's right.
Into damaged lungs.
That's right. So not only are you having all of the problems with the blood vessels and the clotting in your blood vessels, not only are you having all of the problems of oxygen not being able to get to your organs and your organs shutting down from that, but now you're artificially pushing air into your lungs and causing more damage that way.
Another hard lesson of the pandemic and a virus healthcare providers everywhere are still struggling to understand.
We don't quite understand why one person with lab values of X does well, while a person with lab values that appear to be better doesn't make it. And a mask is not a big ask to help save your life.
The work and stress for healthcare workers everywhere crushing, and with rates of infection rising, they expect more work and stress ahead. Stressful for patients as well, who are sick, isolated from everyone.
How tough is it to be in your room all day just sitting there?
Oh man, if you could just hear that unit in the room, it would drive you nuts at first, but you get past it.
28-year-old Michael Vasquez works in a warehouse. He isn't sure how he got sick. He's part of a new program here to get patients up and walking as soon as possible, even a little bit, helping both physically and mentally.
What has it done to your lungs?
It really made them fatigue really bad with the
Vasquez isn't sure if there will be any long-term effects to his lungs. Right now, he's focused on getting home to his wife and 7-year-old son.
I just miss, their presence, miss holding your wife, kissing your son goodnight, going to his room, making sure he's okay. I miss that a lot.
We know that when people walk, when people sleep better, when people see bright light, they get better sooner. We know all of this. I think on some level, we're having to relearn it with COVID because of our response to it. Obviously our need to keep ourselves safe, to keep staff safe. So it's not unexpected that we kind of ended up isolating people, whether we meant to or not.
Another lesson of the pandemic, trying to reduce recovery times and free up beds, badly needed for an expected growing surge of people seriously sick with the coronavirus.
Right now, we are so full upstairs that we are having some delays in getting the patients upstairs because there just aren't beds that are prepared and ready for COVID patients. So we are holding a lot of them in the emergency department right now. Some for hours, some for days.
What's driving the surge here? Doctors aren't entirely sure, but based on what they hear from patients, there was a sense that the worst was behind us.
I don't think that there was one specific incident that really led to this spike. I think people after March and April were extremely frustrated with being inside, and as soon as those restrictions lifted, they wanted to get out. Some protected themselves, some didn't, and now we're just seeing the result of that.
With the holiday weekend coming up, the fear now, the surge of patients, will become a tidal wave.
I don't think I have seen anything like this ever. And I would say that if you want to see August 1st, then maybe you should stay indoors and isolate on July 4th.
Miguel Marquez, CNN, San Antonio, Texas.